Well, I think that's partly what has gotten us into this problem. I mean, there used to be how many interdisciplinary chronic pain programs out there, and now we're reduced to far less than we were before, and we're having those issues where what things have been proven to be most effective, interdisciplinary pain programs, are things that aren't being covered by insurances. Thankfully, based on my setting, I have those options available to me. But I think that's something that we're all facing, is that a lot of times the opioid medication is a lot cheaper than sending someone for CBT for chronic pain, or some newer non-opioid medication, or a whole host of other things.
I think it comes down a lot to some education on the part of the insurance company and the PBMs or whoever's, making these types of decisions about what's covered and what's not covered. So education to that side, but also education to the patient side. So the patients need to understand the limitations with opioids or other medications. Those are just one tool that can be used in the overall treatment of chronic pain. So if they understand that, maybe they'll be more willing to engage or pursue some of these non-pharmacological treatment options that have better evidence, like Dr. Kominek was saying. And looking at really the long-term expenses and the long-term payouts. So sure, opioids or medications in general may be cheaper in the short term or on a month-to-month basis, but when you're looking at long-term outcomes, looking at hospitalizations, ER visits, those types of things, is getting the person into a more expensive treatment that has better outcomes associated with it, saving money in the long run, and improving the patient's overall outcomes for their quality of life and function.